Hi everybody, my name is Scott and I'm a physiotherapist here at Elit Care. I am a physiotherapist first. I use acupuncture as one of my many tools and modalities in my physiotherapy practice. What acupuncture is the insertion of small, very fine needles into anatomical locations throughout the body with the goal of stimulating a muscle, stimulating peripheral nerves, or stimulating connective tissue. So the technique we use, should be a painless needling technique. Sometimes there's a little bit of a pinch when the needle first goes in, and oftentimes if we hit a tight band of muscle, people can feel what they describe as a deep, achy sensation. It's very normal, it happens all the time, it's very common, and it's nothing to worry about. That's a common question we get a lot, is the differences between the more contemporary medical acupuncture and the traditional Chinese medicine acupuncture. So traditional Chinese medicine acupuncture follows meridians of the body with the goal of balancing people's energy, versus the style of acupuncture that I use in my physiotherapy practice is very what we call neurofunctional. Every needle we put has an anatomical target, whether it's a nerve, whether it's a muscle, whether it's a ligament or a piece of connective tissue, and our goal is to either release tension or help stimulate a contraction in the muscle. I would say the most common case we use is any sort of pain with movement disorder, right? So majority of the people we see in a physiotherapy realm have some sort of pain with some sort of movement, right? And through a neurofunctional analysis, we're able to determine what muscles, what nerves, what tissues are involved in the process. And then through the style of acupuncture that we do, we're able to target those structures to help reduce pain, to help reduce tension, and help to restore function. Absolutely. So some of the really acute benefits that people see is a decrease in muscular tension, so a feeling of looseness, a feeling of being better connected to the muscle. So very often after the treatment, people stand up and walk around and say, wow, I feel looser, I feel more connected. And sometimes we can even see a pretty distinct difference in strength immediately after a treatment. Yeah, so there's no blanket statement about things we have to specifically avoid after an acupuncture or physiotherapy session. I will say that becomes very patient specific, right? So there are certain circumstances where I tell people to avoid certain things after treatment, and there's other circumstances where I tell people to do whatever you'd like to do. So that really comes down to a very patient specific situation. So after an acupuncture session, or after using acupuncture in a session, some of the most common side effects are a little bit of muscle soreness in the area that we've been working on, similar to like you just had a workout and the muscle is a little bit sore. That is very common and there's nothing to worry about. Some of the smaller side effects are sometimes we get a little bit of bleeding that results in a very tiny bruise, but again, that's nothing to worry about and a very common side effect. So in a physiotherapy session with me, the priority is patient comfort. So you want to wear some clothing that is comfortable for you and allows you to move in. So that again is a very patient-specific question. I will say there are certain circumstances where I see people twice a week, there's people I see once a month, there's people I see every 6 weeks, so it's very patient-specific. So on your initial assessment, we're going to start with a thorough subjective history, which means we're going to sit, we're going to chat. I'm going to ask you a whole bunch of questions, get a whole bunch of information from you, and then we move into the physical portion of the exam where we get you up, we get you moving, we see how things feel, we see how things are moving, and then we get you lying on the physio bed, which allows me to do a deeper dive into individual joints, individual muscles, and then we conclude that with a plan of care as well as some treatment on the initial session.